Welcome back, dedicated learners. You have officially arrived at Practice Test 23 in our 30-day NCLEX challenge, and your progress so far is nothing short of inspiring. With every test you complete, you are building stronger clinical judgment, mastering critical safety protocols, and getting more confident in your ability to handle real-life nursing scenarios. Practice Test 23 is designed to push your thinking even further, with a blend of high-yield NCLEX-style questions covering topics like infection control, pharmacology, maternal newborn nursing, pediatric care, and emergency interventions. Whether you are tackling delegation questions, prioritization scenarios, or drug safety alerts, remember that each question is preparing you to think like a nurse under pressure. Keep that momentum going. And if you have not yet claimed your free 5-day access to our complete NCLEX crash course, now is the time. Just click the WhatsApp link in the description and send the word "Hi" to get started instantly. All right, sharpen your focus and let us jump into Practice Test 23. You are one step closer to becoming an NCLEX success story. Let's jump on to our following scenarios. Question 1. A nurse is reinforcing instructions to a client who is scheduled for a percutaneous liver biopsy. Which client statement indicates an accurate understanding of the procedure? The options are A. I will be under general anesthesia during the biopsy. B. I should stop using acetaminophen a week before the test. C. I will perform deep breathing and coughing exercises right after the procedure. And D. I might need to hold my breath when the needle is inserted. The correct answer is option D. I might need to hold my breath when the needle is inserted. Let us break down why this is correct. During a percutaneous liver biopsy, the client is awake and typically receives a local anesthetic. To minimize liver movement and reduce the risk of internal injury during the needle insertion, the client is instructed to take a deep breath, exhale, and then hold their breath. This breath hold technique creates a still field for accurate needle placement and helps prevent serious complications like liver laceration or pneumothorax, given the liver's proximity to the diaphragm. As we continue our NCLEX-style journey, let us now turn our attention to a critical question about post-procedural complications and prioritization of care. Question 2. A nurse is reviewing the conditions of 4 assigned clients. Which client requires the most immediate nursing attention? The options include A. A client diagnosed with influenza who has a temperature of 102 degrees Fahrenheit or 39 degrees Celsius. B. A client who recently underwent a thoracentesis and now reports persistent coughing. C. A client who has blood-tinged sputum shortly after undergoing bronchoscopy. And D. A client with active tuberculosis walking to radiology wearing a standard surgical mask. The correct answer is option B. A client who recently underwent a thoracentesis and now reports persistent coughing. This option is prioritized because persistent coughing after a thoracentesis can indicate a developing pneumothorax, a serious and potentially life-threatening complication. Thoracentesis involves inserting a needle into the pleural space to drain excess fluid, and there is always a risk of puncturing the lung tissue, allowing air to escape into the pleural cavity. Early warning signs of pneumothorax include a new or worsening cough, shortness of breath, tachycardia, chest tightness, and decreased breath sounds on the affected side. Let us now transition from prioritization to therapeutic communication and environmental adaptation, especially for clients with sensory impairments. Question 3. The nurse is caring for a newly admitted client with legal blindness. Which nursing action is most appropriate to help reduce the client's initial anxiety? The available options are A. Place the client in a single bed room to minimize stimulation. B. Give a detailed verbal orientation to the layout of the room. C. Request continuous observation by assigning a sitter. And D. Ask the unlicensed assistive personnel to monitor the client frequently. The correct answer is option B. Give a detailed verbal orientation to the layout of the room. Clients with legal blindness often experience disorientation and fear when introduced to new and unfamiliar environments. So the nurse's ability to clearly and calmly describe the surroundings using verbal and spatial cues plays a vital role in reducing anxiety. For instance, phrases like, "The bedside table is directly to your left," or "Your call light is located near your right hand," empower the client with a mental map that fosters autonomy and security. This method not only improves safety, but also supports the therapeutic relationship between the nurse and the client. Moving forward in our NCLEX-style series, let us now explore a pharmacological application question involving safe transdermal medication practices. Question 4. The nurse is preparing to administer a dose of nitroglycerin ointment as prescribed for a client with angina. Which action is most appropriate to ensure safe and effective medication delivery? The choices are A. Apply the ointment only to the upper chest area. B. Massage the ointment into the skin until fully absorbed. C. Change the site of application with each dose. And D. Place a gauze dressing over the medication strip after applying. The correct answer is option C. Change the site of application with each dose. Rotating application sites is critical when using nitroglycerin ointment to avoid local skin irritation, prevent contact dermatitis, and reduce the risk of tachyphylaxis, a decrease in medication effectiveness due to repeated exposure at the same site. Nitroglycerin works by delivering a consistent dose transdermally to cause vasodilation, decreasing myocardial oxygen demand and relieving angina symptoms. To ensure proper absorption, the nurse should always apply it to a clean, dry, hairless area of intact skin, such as the chest, upper arms, or back, and use a different location with each application. Question 5. A 32-year-old pregnant client at 32 weeks gestation visits the prenatal clinic and expresses concern about reddish streaks developing on her abdomen. Based on this description, which of the following images best represents the likely finding? The correct answer is option D, image D. This image displays striae gravidarum, commonly known as stretch marks, which are pink or purplish streaks that typically appear on the abdomen during the later stages of pregnancy. These marks result from the rapid stretching of the skin as the uterus grows, combined with hormonal influences, particularly estrogen, progesterone, and melanocyte-stimulating hormone, which affect the elasticity of the skin. The underlying dermal elastic fibers become disrupted, causing these streaks to emerge. While they may initially appear red or purple, over time they often fade to a silvery white color postpartum. Shifting our focus now to the critical care setting, question 6 highlights the importance of stress ulcer prevention in intubated clients receiving mechanical ventilation. A nurse is caring for a hospitalized client who is currently intubated and receiving mechanical ventilation. Which of the following medications would the nurse most likely expect the healthcare provider to prescribe for stress ulcer prevention? The options include A. Hydroxyzine, B. Pantoprazole, C. Rivastigmine, and D. Verapamil. The correct answer is option B. Pantoprazole. This medication is a proton pump inhibitor, PPI, that significantly decreases gastric acid secretion, helping to protect the stomach lining in clients who are critically ill or mechanically ventilated. Such clients are at high risk for developing stress-related mucosal disease, SRMD, due to reduced perfusion to the gastrointestinal tract and increased gastric acid production. These changes can lead to ulcer formation, gastrointestinal bleeding, and even perforation if not addressed. Administering pantoprazole can prevent these complications and is a standard component of stress ulcer prophylaxis in intensive care settings. Now let us pivot into emergency and bioterrorism preparedness, with question 7 focusing on the immediate nursing response to a life-threatening exposure. A client arrives in the emergency department after suspected exposure to inhalation anthrax. Which of the following nursing interventions should take top priority? The available options are A. Begin continuous oxygen saturation monitoring. B. Request a chest X-ray to assess lung status. C. Notify the local public health authorities. And D. Prepare the client for a cerebrospinal fluid analysis. The correct answer is option A. Begin continuous oxygen saturation monitoring. Inhalation anthrax is a critical and potentially fatal condition caused by inhaling Bacillus anthracis spores. It progresses rapidly, leading to severe respiratory distress, hypoxia, and possibly septic shock. Therefore, the first and most urgent nursing action is to monitor oxygen saturation continuously to detect early signs of respiratory compromise. This allows the healthcare team to intervene promptly with oxygen therapy, or even intubation if needed. Now turning our attention to postoperative care and complication prevention, question 8 highlights the importance of prioritizing interventions in a high-risk surgical population. The nurse is formulating a postoperative care plan for a client who has just undergone bariatric surgery. Which intervention is most appropriate to help prevent a common postoperative complication? The options provided are A. Apply pneumatic compression devices to the client's lower extremities. B. Insert a Foley catheter to monitor fluid balance. C. Maintain the client on complete bed rest for 24 hours. And D. Measure abdominal circumference every shift. The correct answer is option A. Apply pneumatic compression devices to the client's lower extremities. Bariatric surgery patients face an increased risk for venous thromboembolism, VTE, due to several factors, such as obesity, reduced mobility, anesthetic effects, and the inflammatory response from surgery. Sequential compression devices, SCDs, also known as pneumatic compression devices, work by promoting venous return and preventing blood from pooling in the lower extremities. This intervention is crucial in minimizing the development of deep vein thrombosis, DVT, and pulmonary embolism, PE, both of which can be fatal. Continuing with medication administration and caregiver education, question 9 focuses on ensuring proper technique and safety when administering subcutaneous injections at home. A nurse is educating a family caregiver on how to properly administer a subcutaneous dose of enoxaparin at home. Which caregiver's statement indicates the need for additional instruction? The answer choices are A. I will inject the medication into the abdominal area. B. I will insert the needle at a 30-degree angle under the skin. C. It is safe to take acetaminophen if any pain develops. And D. We will switch to a soft bristle toothbrush while on this medication. The correct answer is option B. I will insert the needle at a 30-degree angle under the skin. This statement reflects a misunderstanding of proper injection technique. Enoxaparin is a low molecular weight heparin administered subcutaneously, usually in the fatty tissue of the abdomen. The correct injection angle is 90 degrees for clients with adequate subcutaneous fat, or 45 degrees for thinner individuals. A 30-degree angle is too shallow and risks intradermal administration, which can impair absorption and effectiveness while increasing irritation. Now shifting our focus to pediatric post-operative care, question 10 highlights airway management following cleft lip surgery in infants, a critical area of nursing vigilance. An infant has just returned to the recovery unit following surgical repair of a cleft lip. Which item should the nurse ensure is readily available at the bedside to address a common post-operative concern? The options are A. Nasogastric tube, B. Bottle of sterile water, C. Suction device or bulb syringe, and D. Emergency tracheostomy tray. The correct answer is option C. Suction device or bulb syringe. After a chyloplasty, infants are often mildly sedated and may struggle with clearing their own oral secretions. Due to anesthesia effects and developmental limitations, there is an increased risk of aspiration if secretions are not managed promptly. A bulb syringe or suction device allows immediate intervention if the infant begins to gag, choke, or display signs of respiratory distress. While routine suctioning is minimized to protect the surgical site, having the equipment available is essential for emergent use. Hey, quick pause. If you are finding this helpful, I have something exciting to share that could take your prep to the next level. For a limited time, you can get free 5-day access to our complete NCLEX crash course. No credit card, no commitment, just pure value. Inside, you will unlock live and recorded review sessions, 5,000 plus real NCLEX-style questions, case study walkthroughs, PDF study guides, and customized study plans tailored just for you. All you have to do is click the WhatsApp link in the description and send the word "Hi." It is that simple. Our team will instantly enroll you so you can dive in today. Do not miss this opportunity. Let us help you pass the NCLEX with confidence. Now, let us get back to the lecture. Now, turning to the critical care of neonates. Question 11 focuses on congenital heart conditions and the importance of pulse assessments in infants. A nurse in the emergency department assesses a 3-day-old infant brought in by the mother, who reports, "My baby feels very warm and sweaty and refuses to feed." On physical assessment, the nurse notes absent femoral pulses and bounding brachial pulses. Based on these findings, which congenital heart defect is most likely? The answer options are A. Hypoplastic left heart syndrome, HLHS, B. Patent ductus arteriosus, PDA, C. Transposition of the great arteries, TGA, and D. Coarctation of the aorta, COA. The correct answer is option D. Coarctation of the aorta, COA. This condition is caused by narrowing in the aortic arch, often distal to the branches that supply the upper extremities. As a result, there is strong perfusion to the upper body, producing bounding brachial pulses, while the lower extremities receive diminished blood flow, resulting in absent or weak femoral pulses. Other signs such as poor feeding, sweating, and irritability may reflect congestive heart failure or low cardiac output. Thus, the classic hallmark of COA, discrepant pulses, points directly to the diagnosis and demands urgent echocardiographic confirmation and early surgical intervention. As we shift from infant cardiac emergencies to foundational assessment skills, question 12 asks, what is the primary objective of performing a comprehensive health assessment during client care? The options are A, to collect both subjective and objective information about the client, B, to establish a list of nursing interventions, C, to evaluate whether the nursing care plan is effective, and D, to implement direct action to resolve identified issues. The correct answer is option A, to collect both subjective and objective information about the client. The comprehensive health assessment is the first step of the nursing process and serves as the foundation for all subsequent decision-making. Subjective data includes the client's reported symptoms, feelings, and perceptions, such as pain or fatigue, while objective data includes measurable findings like temperature, blood pressure, or skin color. These data points allow the nurse to develop a clear understanding of the client's current condition, which is essential for formulating a personalized care plan. Moving into maternity unit prioritization, question 13 asks, the charge nurse must make space on the maternity unit by transferring one client to the medical surgical floor. Which of the following clients would be the most appropriate for transfer? The options are A, a pregnant client in the 3rd trimester with ongoing preterm contractions needing continuous monitoring, B, a postpartum client recovering from a cesarean delivery who requires wound care and pain management, C, a client with preeclampsia complaining of a persistent frontal headache, and D, a 2nd trimester client undergoing evaluation for gestational diabetes and awaiting a non-stress test. The correct answer is option B, a postpartum client recovering from a cesarean delivery who requires wound care and pain management. This client is medically stable, no longer pregnant, and requires standard post-surgical care, services that are well managed on a medical surgical unit. The other clients, however, all remain pregnant and require specialized obstetric monitoring. Thus, the safest and most appropriate transfer is the postpartum client, ensuring continuity of care without compromising maternal fetal safety. Now transitioning to post-fracture care and potential neurovascular emergencies, question 14 presents the following. A client with a newly applied fiberglass, cast on the left arm for a humerus fracture, reports finger numbness and observes that the fingers appear pale 3 hours later. What is the nurse's most appropriate response? The options are A, inform the client that this is expected after a fresh cast application, B, instruct the client to repeatedly squeeze their hand, C, remove the cast immediately to relieve pressure, and D, contact the healthcare provider without delay. The correct answer is option D, contact the healthcare provider without delay. These findings, numbness and pallor, are hallmark early signs of compartment syndrome, a surgical emergency caused by increased pressure in a closed muscle compartment that reduces circulation and damages tissue. If left untreated, it may result in permanent nerve injury or loss of limb. The nurse's role is to recognize these signs and notify the provider immediately for possible interventions such as cast splitting or fasciotomy. Prompt recognition and escalation are the keys to preserving limb function. Next, we turn our attention to medication safety and pharmacological relevance in question 15, where a nurse reviewing newly initiated medication orders must identify which one may not align with the client's diagnosis. The options are A, furosemide prescribed for a client diagnosed with hyperparathyroidism, B, methimazole prescribed for a client with hyperthyroidism, C, hydrocortisone prescribed for a client with diabetes insipidus, and D, prazosin prescribed for a client diagnosed with pheochromocytoma. The correct answer is option C, hydrocortisone prescribed for a client with diabetes insipidus. Hydrocortisone is a corticosteroid used in adrenal insufficiency, such as Addison's disease, but it plays no role in the treatment of diabetes insipidus, DI. DI is characterized by a lack of antidiuretic hormone, ADH, or renal resistance to it, leading to excessive urine output and severe dehydration. Central DI is typically treated with desmopressin, a synthetic ADH analog, and misprescribing hydrocortisone could delay appropriate care and worsen fluid imbalance. This question highlights the importance of aligning pharmacological therapy with the underlying pathophysiology. Following that, question 16 focuses on triaging symptoms during pregnancy. A nurse is taking phone calls from several pregnant clients. Which client should be prioritized for immediate follow-up? The choices include A. A client at 16 weeks gestation who reports light fluttering movements in her abdomen. B. A client at 30 weeks gestation who has perianal itching and notices bright red blood after a bowel movement. C. A client at 28 weeks gestation who complains of occasional leg cramps and mild swelling in her feet. And D. A client at 38 weeks gestation who reports increasing lower back pain that worsens when walking. The correct answer is option D. A client at 38 weeks gestation who reports increasing lower back pain that worsens when walking. This client may be experiencing true labor, which often begins as lower back discomfort that radiates forward and worsens with movement. The fact that the pain intensifies when walking suggests it is not Braxton Hicks contractions, but rather labor-related, warranting immediate assessment and possible hospital admission. Prioritizing signs of labor is essential to ensure timely intervention and safety for both mother and fetus. We now move to question 17, where the nurse is assessing a client diagnosed with syndrome of inappropriate antidiuretic hormone secretion, SIADH. Which finding is most consistent with this condition? The answer options are A. Noticeable swelling in the lower extremities, B. Large volumes of diluted urine output, C. Blood pressure that is within normal range or slightly elevated, and D. Urine that is highly diluted with low specific gravity. The correct answer is option C. Blood pressure that is within normal range or slightly elevated. SIADH is marked by excessive ADH release, leading to water retention, dilutional hyponatremia, and slight fluid overload. However, the fluid retention tends to be evenly distributed, so clients often appear euvolemic, with subtle weight gain rather than overt edema. The water retention can slightly elevate blood pressure due to increased circulating volume. Transitioning into mobility and safety, question 18 addresses proper transfer technique. The nurse is assisting a client with right-sided weakness in transferring from bed to wheelchair. What is the safest approach? The options are A. Position the wheelchair close to the bed on the client's stronger side. B. Place the wheelchair next to the client's weaker side for easier access. C. Remove the client's non-skid socks to improve floor contact. And D. Use the client's arm to gently guide them into a seated position. The correct answer is option A. Position the wheelchair close to the bed on the client's stronger side. This technique leverages the client's unaffected side to support the transfer, allowing them to pivot safely and maintain stability. This approach also encourages independence while reducing the risk of falls. Safe transfers require not only proper equipment, but also an understanding of client strength and body mechanics. Finally, in question 19, the focus shifts to substance intoxication in the emergency setting. A client presents with restlessness, extreme anxiety, dilated pupils, elevated blood pressure, and heavy sweating. The nurse suspects intoxication from which substance? The answer choices are A. Opioids, B. Barbiturates, C. Amphetamines, and D. Cannabis. The correct answer is option C. Amphetamines. These central nervous system stimulants produce a distinct toxidrome characterized by mydriasis, agitation, tachycardia, hypertension, paranoia, and hyperthermia. Clients may appear extremely restless and aggressive and can experience seizures at toxic doses. Management often includes calming agents such as benzodiazepines and supportive cardiovascular care. Recognizing toxidromes is essential in emergency nursing practice to guide appropriate interventions quickly. Now shifting into laboratory interpretation, question 20 presents, the nurse is reviewing a client's ABG values, which show a pH of 7.50, a PaCO2 of 28 millimeters of mercury, and a bicarbonate level of 25 milliequivalents per liter. Based on these findings, how should the nurse interpret the results? Here are the options. Option A, metabolic alkalosis. Option B, respiratory acidosis. Option C, respiratory alkalosis. And option D, metabolic acidosis. The correct answer is option C, respiratory alkalosis. Let us break it down. A pH of 7.50 indicates that the client is in a state of alkalosis, since the normal pH range is 7.35 to 7.45. Now looking at the PaCO2, which is 28 millimeters of mercury, that is below the normal range of 35 to 45. suggesting that carbon dioxide is being exhaled excessively. This drop in carbon dioxide, a respiratory acid, points toward a respiratory cause of the alkalosis. The bicarbonate level is within normal limits, meaning it is not a metabolic issue. So, putting all this together, we have a high pH, low PaCO2, and normal HCO3, confirming respiratory alkalosis. Before moving, hold on just a second. If you are serious about passing the NCLEX, you need to check this out. We are offering free 5-day access to our complete NCLEX crash course, including live review classes, strategy guides, PDFs, and over 5,000 exam-style questions. Just click the WhatsApp link in the description and message "Hi." We will unlock everything for you instantly. This could be the game changer you have been looking for. Let us keep going. Transitioning to emergency neurological care, question 21 focuses on the early identification of stroke symptoms. A client arrives at the emergency department reporting sudden weakness on one side of the body and slurred speech. The nurse suspects a possible stroke. Which additional finding would most support this suspicion? The options are A. Presence of an irregular heart rhythm. B. Drop in blood pressure upon standing. C. Noticeable difference in pupil size between the eyes. And D. Low blood glucose level on capillary test. The correct answer is option C. Noticeable difference in pupil size between the eyes. This condition, known as anisocoria, may reflect increased intracranial pressure or brainstem involvement, both of which are seen in certain types of strokes, particularly large ischemic or hemorrhagic strokes. When combined with unilateral weakness and slurred speech, unequal pupils serve as a red flag for urgent imaging and stroke team activation. Now for the incorrect responses. Therefore, unequal pupils in the setting of hemiparesis and speech changes strongly reinforce the diagnosis of acute stroke. As we transition into the realm of neurological and musculoskeletal assessment, question 22 highlights the importance of recognizing abnormal reflex responses. The nurse is conducting a neurological and musculoskeletal exam. Which observation would confirm the presence of clonus in a client? The answer options are A. A reddish discoloration of the feet and ankles when legs are placed in a dependent position. B. Involuntary, rhythmic muscle jerking following sudden dorsiflexion. C. Audible snapping or clicking sound in the knee with flexion and extension. And D. Crackling and grinding sounds felt and heard in joints during movement. The correct answer is option B. Involuntary, rhythmic muscle jerking following sudden dorsiflexion. Clonus is a hallmark sign of upper motor neuron dysfunction and reflects exaggerated reflex activity. To assess for clonus, the nurse briskly dorsiflexes the foot and holds it. A positive result is a rhythmic, uncontrollable jerking motion that signals neurological hyperactivity. Common causes include stroke, spinal cord injury, or multiple sclerosis. Next, we move into the world of maternity nursing with question 23, which addresses prenatal education on appropriate weight gain. During a prenatal class, the nurse is teaching clients about healthy weight gain during pregnancy. Which weight gain range is most appropriate for a pregnant individual who begins pregnancy with a normal body mass index, BMI? The options are A. 28 to 40 pounds, B. 25 to 35 pounds, C. 15 to 25 pounds, and D. 11 to 20 pounds. The correct answer is option B. 25 to 35 pounds. For individuals with a normal pre-pregnancy BMI of 18.5 to 24.9, this weight range supports optimal fetal growth and reduces the risk of complications such as low birth weight or macrosomia. Typically, weight gain occurs gradually, about 1 to 4 pounds in the first trimester and approximately 1 pound per week during the second and third trimesters. Shifting from maternal care to respiratory complications, question 24 focuses on assessment techniques related to chest tube management. While caring for a client with a chest tube, the nurse wants to assess for the presence of subcutaneous emphysema. Which technique should the nurse use to detect this complication? The options include A. Apply deep pressure to the abdomen and assess for pain upon release. B. Gently palpate the tissue surrounding the chest tube for crackling beneath the skin. C. Listen to bowel sounds in all 4 quadrants using a stethoscope. And D. Visually monitor the client's chest for symmetrical expansion during respiration. The correct answer is option B. Gently palpate the tissue surrounding the chest tube for crackling beneath the skin. Subcutaneous emphysema occurs when air leaks into the subcutaneous tissues, often due to chest trauma or air escaping from a chest tube site. It produces a classic crackling or Rice Krispies sensation under the skin, which is best detected through light palpation. While often benign if localized, rapid spread can threaten airway and respiratory function. Finally, we move into hepatic care in question 25, where medication efficacy is evaluated through clinical observation. A client diagnosed with liver cirrhosis is being treated with lactulose. Which clinical observation would suggest that the medication is having its intended therapeutic effect? The options are A. Elevated liver enzyme values, B. Noticeable improvement in mental clarity, C. Reduction in urinary calcium excretion, and D. Higher gastric pH readings. The correct answer is option B. Noticeable improvement in mental clarity. Lactulose is a synthetic disaccharide used to treat hepatic encephalopathy by trapping ammonia in the colon and facilitating its excretion through bowel movements. When effective, lactulose reduces serum ammonia levels, leading to improved cognitive function, alertness, and orientation. Next, we turn to a case of inflammatory joint disease in question 26, which examines pharmacologic management for a client newly diagnosed with rheumatic fever. The question asks, a client presents with joint pain and swelling consistent with polyarthritis due to a recent diagnosis of rheumatic fever. Which of the following medications would the nurse most likely expect to be prescribed to manage this condition? The answer choices are A. Prazosin, B. Naproxen, C. Verapamil, and D. Furosemide. The correct answer is option B. Naproxen. This non-steroidal anti-inflammatory drug, NSAID, is frequently used to manage the joint inflammation, pain, and fever associated with rheumatic fever, which is a post-streptococcal autoimmune condition. Polyarthritis is one of the earliest symptoms and often migrates from one large joint to another. Naproxen provides long-lasting symptom relief and is favored for its dual action as an anti-inflammatory and antipyretic agent. Shifting now to pediatric respiratory health in question 27, the focus is on identifying causative pathogens. The nurse is educating the parents of a 1-year-old child diagnosed with bronchiolitis. The nurse explains that the condition is most commonly caused by which of the following viral pathogens? The options are A. Haemophilus influenzae type B, B. Adenovirus, C. Respiratory syncytial virus, RSV, and D. Rhinovirus. The correct answer is option C. Respiratory syncytial virus, RSV. RSV is the leading cause of bronchiolitis in infants under 2 years of age and is especially prevalent in the winter months. It infects the lower respiratory tract, causing inflammation, mucus buildup, wheezing, and difficulty breathing. Most cases are self-limited and treated with supportive care such as hydration, suctioning, and oxygen if needed. Now turning to injection technique and safety, question 28 asks, the nurse is preparing to give an intradermal injection for diagnostic testing. Which action demonstrates correct injection technique? The options include A. Displace the skin to the side and inject at a 15-degree angle, B. Position the needle bevel up at 15 degrees, C. Position the needle bevel up at 45 degrees, and D. Insert the needle at a 45-degree angle to ensure dermal placement. The correct answer is option B. Position the needle bevel up at 15 degrees. Intradermal injections are administered into the dermis using a shallow angle and a fine needle to form a small bleb or wheal, which is essential for tests like the tuberculin skin test. Infection control is the highlight of question 29, which tests knowledge of sterile technique. The nurse is preparing to apply sterile gloves before a sterile procedure. Which action is most essential to prevent contamination during the process? The choices are A. Keep the hands above waist level, B. Select gloves that are one size larger than usual, C. Wear a sterile gown before donning the gloves, and D. Put on the glove on the non-dominant hand first. The correct answer is option A. Keep the hands above waist level. According to the principles of surgical asepsis, anything below the waist is considered contaminated. Therefore, during the donning process, the nurse must keep both the glove packaging and hands above waist level at all times to maintain sterility. Next, question 30 brings us back to chest tube care. The nurse is obtaining vital signs from a client with a chest tube. While observing respirations, the nurse notices that the water in the water seal chamber rises and falls with the client's breathing. What is the most appropriate nursing action? The answer choices are A. Finish counting the client's respirations, B. Empty the water seal chamber, C. Assist the client with incentive spirometry, and D. Notify the charge nurse. The correct answer is option A. Finish counting the client's respirations. The observed tidling, rising and falling of the water level is a normal and expected finding, indicating that the chest drainage system is patent and working properly. Before we proceed on, are you feeling overwhelmed with all the NCLEX topics? You are not alone, and we have got your back. You can now access our full NCLEX crash course completely free for 5 days. No payment, no risk, just results. It is packed with high-yield lectures, case studies, and thousands of practice questions. Click the WhatsApp link below, say hi, and start now. All right, let us continue with the content. Finally, in question 31, we are presented with a trauma scenario involving possible chest injury. A client is brought to the emergency department after being struck in the chest with a baseball bat. Which finding would most support the diagnosis of a pneumothorax? The options are A. Decreased respiratory rate, B. Diminished breath sounds, C. Presence of a barrel chest, and D. A sucking sound at the injury site. The correct answer is option B. Diminished breath sounds. A pneumothorax occurs when air accumulates in the pleural space, collapsing the lung and leading to reduced or absent breath sounds on the affected side. It is a hallmark sign that prompts immediate further evaluation and chest X-ray. Recognizing these early signs allows for rapid intervention, such as needle decompression or chest tube insertion, to restore lung expansion and oxygenation. Now shifting to postpartum pharmacology, question 32 focuses on the expected outcomes of uterotonic therapy. A postpartum client is receiving prescribed methylergonavine. Which finding indicates the medication is effective? The options are A. Increased blood pressure, B. Decreased postpartum bleeding, C. Decreased uterine tone, and D. Increased urinary output. The correct answer is option B. Decreased postpartum bleeding. Methylergonavine stimulates sustained contraction of the uterine muscle to compress blood vessels and control postpartum hemorrhage. A firm fundus and reduction in lochial flow are therapeutic signs of effectiveness. Next, question 33 addresses a potentially life-threatening electrolyte imbalance in a client with syndrome of inappropriate antidiuretic hormone, SIADH. The nurse is monitoring a client with SIADH. Which assessment finding requires immediate nursing action? The options are A. Disorientation, B. High urine-specific gravity, C. Oliguria, and D. Increased thirst. The correct answer is option A. Disorientation. Disorientation in SIADH suggests worsening hyponatremia, which can lead to seizures, cerebral edema, or coma if not treated urgently. This neurological change is a red flag requiring immediate intervention, such as fluid restriction or hypertonic saline therapy. Now focusing on post-procedural priorities, question 34 examines care following a thoracentesis. A client has just undergone a bedside thoracentesis. Which action should the nurse perform first? The answer choices are A. Instruct the client to take slow, shallow breaths, B. Assess the client's respiratory status, C. Label the lab specimen for culture, and D. Call radiology for a post-procedure chest X-ray. The correct answer is option B. Assess the client's respiratory status. Immediately after thoracentesis, the nurse must evaluate for complications such as pneumothorax, bleeding, or respiratory distress. Monitoring breath sounds, oxygen saturation, and chest symmetry ensures that the lung has not collapsed and that the client remains stable. We now turn to cardiovascular medication education in question 35, where the nurse evaluates a client's understanding of sublingual nitroglycerin use. A nurse is reviewing teaching with a client newly prescribed sublingual nitroglycerin for acute angina. Which statement made by the client indicates the need for further follow-up? The options are A. I will get a refill of my prescription every 6 months. B. I will take 1 tablet every 2 minutes if chest pain occurs. C. I will place my medication in a dark amber bottle. And D. I must not chew on the tablet when taking it. The correct answer is option B. I will take 1 tablet every 2 minutes if chest pain occurs. This response reflects a critical misunderstanding. Nitroglycerin should be taken 1 tablet every 5 minutes, up to 3 times. And emergency help should be sought if pain persists after the first dose. Taking it every 2 minutes can cause severe hypotension and syncope. Lastly, question 36 emphasizes client prioritization based on neurovascular risk. The nurse is caring for 4 assigned clients. Which client should the nurse assess first? The options are A. A client recovering from femoral angioplasty who reports their foot is falling asleep. B. A client with diabetes mellitus who refused their prescribed glargine insulin. C. A client who received alteplase 3 hours ago for a stroke and has a Glasgow Coma scale of 14. And D. A client with a T6 spinal cord injury who has not had a bowel movement since yesterday. The correct answer is option A. A client recovering from femoral angioplasty who reports their foot is falling asleep. This symptom could indicate neurovascular compromise, such as ischemia or occlusion following arterial catheterization. Immediate assessment of pulses, color, temperature, and sensation is required to preserve limb viability. This scenario highlights how subtle neurovascular symptoms demand swift action to prevent irreversible harm. To begin this section, question 37 brings us into pediatric psychosocial development. The nurse is performing a psychosocial assessment on a 2-month-old infant. According to Erickson's stages of psychosocial development, which stage is most appropriate for this age group? The options are A. Initiative versus guilt. B. Autonomy versus shame and self-doubt. C. Trust versus mistrust. And D. Industry versus inferiority. The correct answer is option C. Trust versus mistrust. Erickson's first stage occurs from birth to 18 months, where infants rely entirely on caregivers to meet basic needs. If those needs are met consistently with love and reliability, the infant learns to trust their environment, forming the foundation for secure emotional development. Nurses can promote this by supporting skin-to-skin contact, encouraging breastfeeding routines, and facilitating bonding. Shifting focus to obstetrics, question 38 addresses safety in placenta previa management. The nurse is caring for a client diagnosed with placenta previa. Which of the following prescriptions from the primary healthcare provider should the nurse question? The options are A. Manual cervical examination. B. Transabdominal ultrasound. C. Non-stress test. And D. Transvaginal ultrasound. The correct answer is option A. Manual cervical examination. In placenta previa, the placenta partially or completely covers the cervical os, and digital examination may disrupt the placenta, triggering massive hemorrhage. Therefore, manual cervical checks are strictly contraindicated unless previa is definitively ruled out. Nurses must ensure that no vaginal examination is done when previa is known or suspected, and must educate clients on pelvic rest precautions. Now turning to an orthopedic emergency, question 39 examines compartment syndrome. The nurse is caring for a client who has developed compartment syndrome of the left lower extremity. After calling a rapid response and receiving an order for emergency surgery, what is the nurse's priority action? The choices are A. Perform medication reconciliation. B. Reassess vital signs. C. Provide an update to the client's family. And D. Transport the client to the operating room. The correct answer is option D. Transport the client to the operating room. Compartment syndrome is a time-sensitive emergency that requires surgical fasciotomy to relieve pressure and restore perfusion. Delaying transport could result in permanent muscle and nerve injury or even limb loss. Finally, in question 40, we look at intravenous complications. The nurse is caring for a client receiving a continuous infusion of isotonic fluids and observes signs of infiltration at the vascular access site. Which action should the nurse take first? The options are A. Reduce the infusion rate and elevate the affected extremity. B. Stop the infusion and remove the intravenous catheter. C. Stop the infusion and reposition the intravenous catheter into the vein. And D. Reduce the infusion rate and apply a warm compress to the intravenous site. The correct answer is option B. Stop the infusion and remove the intravenous catheter. Infiltration means the fluid is leaking into the surrounding tissue, leading to swelling, coolness, and discomfort. Immediate discontinuation of the IV prevents further tissue damage. Real quick, if you are loving this content, you are going to love what we have inside our NCLEX crash course even more. We are giving away 5 days of full access for free. And that includes video lectures, exam strategies, notes, quizzes, and support from our expert team. Just click the WhatsApp link in the description and send hi to get enrolled instantly. Now, back to the good stuff. Starting with geriatric priorities in question 41, the nurse is collecting a focused health history from an older adult client. Which area should take priority? The options are A. Birth history, immunization record, and developmental milestones. B. Obstetric and pregnancy history along with emotional wellness. C. Religious beliefs, cultural values, and spiritual practices. And D. Sensory changes, chronic illness history, and lifestyle patterns. The correct answer is option D. Sensory changes, chronic illness history, and lifestyle patterns. For older adults, these factors directly impact their functional status, safety, and quality of life. Evaluating sensory function like hearing and vision helps prevent communication issues and accidents, while understanding chronic illness history informs medication safety and long-term care planning. Lifestyle behaviors such as diet, mobility, and social engagement offer key insights into current risks and support needs. Now let us examine question 42, which focuses on cardiac rhythm interpretation. The nurse reviews a telemetry strip showing occasional wide, bizarre QRS complexes without visible P waves before them. What is the most appropriate action? The options include A. Prepare for synchronized cardioversion. B. Obtain a prescription for intravenous atropine. C. Review the client's most recent laboratory results. And D. Assess for the presence of a carotid pulse. The correct answer is option C. Review the client's most recent laboratory result. These findings represent premature ventricular contractions, or PVCs, early ventricular beats that are often triggered by low potassium or magnesium, myocardial irritability, or stimulant use. Reviewing labs allows the nurse to identify and correct the underlying cause. In question 43, we move into musculoskeletal nursing care. The nurse is evaluating a client's understanding of cane ambulation. Which action by the client shows proper learning? The answer choices are A. Positions the cane on their weaker side. B. Advances the weaker leg first, then the cane. C. Measures the height of the cane from their wrist crease. And D. Advances the cane 12 to 16 inches with each step. The correct answer is option C. Measures the height of the cane from their wrist crease. Proper cane height ensures the client maintains balance and elbow flexion of 20 to 30 degrees during walking. The top of the cane should align with the wrist crease or greater trochanter when the client stands upright. And now for question 44, which covers infection control in community settings. The nurse is discharging a client with a skin abscess that tested positive for methicillin-resistant Staphylococcus aureus, MRSA. Which instruction should be emphasized? The options are A. Avoid using alcohol-based hand sanitizer. B. Use disposable dishes and utensils for all meals. C. Wear a surgical mask when you are out in public. And D. Keep the wound covered with a dry bandage. The correct answer is option D. Keep the wound covered with a dry bandage. MRSA spreads primarily through contact with infected wounds or contaminated surfaces. Keeping the wound clean, dry, and covered reduces the chance of transmission and promotes healing. Continuing into neurocognitive assessment, question 45 centers on speech patterns and brain injury. The nurse is assessing a client with suspected Wernicke's aphasia. Which of the following findings is most consistent with this condition? The options are A. The client is unable to perform purposeful motor tasks. B. The client is completely unable to produce speech. C. The client experiences difficulty swallowing fluids. And D. The client speaks fluently, but uses nonsensical or jumbled words. The correct answer is option D. The client speaks fluently, but uses nonsensical or jumbled words. Wernicke's aphasia, also called receptive aphasia, affects the language comprehension center in the temporal lobe. Clients speak with normal rhythm and volume, but their sentences lack logical structure or meaning, a phenomenon called word salad. They often remain unaware of their deficit, a condition known as anosognosia. Next, in question 46, we examine cardiac nursing priorities. The nurse is preparing a care plan for a client admitted with cardiac arrhythmias. Which nursing action should be given the highest priority during the initial phase of care? The choices are A. Perform auscultation of heart sounds. B. Initiate continuous electrocardiogram ECG monitoring. C. Check and document all vital signs. And D. Insert a secondary intravenous IV line for access. The correct answer is option B. Initiate continuous electrocardiogram ECG monitoring. Continuous cardiac monitoring allows for real-time recognition of potentially lethal arrhythmias, guiding urgent interventions like cardioversion or defibrillation. While auscultation, vital signs, and IV access are important, none are as time-sensitive or diagnostic in identifying arrhythmias. Transitioning into respiratory emergencies, question 47 focuses on recognizing complications of congestive heart failure. The emergency department nurse is evaluating a client with known heart failure, who presents with shortness of breath and a persistent cough. The vital signs show pulse 108, respirations 28, blood pressure 164/93, oxygen saturation 87%, and temperature 99.5 degrees Fahrenheit. What complication should the nurse suspect? Options include A. Pulmonary embolism, B. Hypovolemic shock, C. Disseminated intravascular coagulation, DIC, and D. Pulmonary edema. The correct answer is option D. Pulmonary edema. The client's tachycardia, dyspnea, hypoxia, and elevated blood pressure point to fluid accumulation in the lungs, a hallmark of acute pulmonary edema, secondary to heart failure. This condition compromises gas exchange and requires immediate treatment with oxygen, diuretics, and vasodilators. Finally, question 48 explores culturally competent care. The nurse is preparing to administer a prescribed blood transfusion to a client. Which cultural or religious group is most likely to refuse this intervention based on religious beliefs? The answer options are A. Catholicism, B. Jehovah's Witnesses, C. Islam, and D. Christian Reformed. The correct answer is option B. Jehovah's Witnesses. This group prohibits receiving blood or its components due to scriptural interpretation, even in emergencies. Nurses must confirm client wishes, review legal documents, and respect autonomy. Moving into endocrine patterns and early morning glucose fluctuations, question 49 presents a scenario involving a client with type 1 diabetes mellitus who shows early morning hyperglycemia between 5 a.m. and 6 a.m. The nurse suspects a hormonal cause. Which condition best explains this glucose rise? The options are A. Dawn phenomenon, B. Somogyi effect, C. Hyperosmolar hyperglycemic syndrome, HHS, and D. Diabetic ketoacidosis, DKA. The correct answer is option A. Dawn phenomenon. This is a natural surge of counter-regulatory hormones, like cortisol and growth hormone, during the early morning hours that causes fasting hyperglycemia, especially in clients with type 1 diabetes. This is not related to nocturnal hypoglycemia. Switching gears to leadership, question 50 focuses on nursing performance appraisals. The supervisor wants to reduce bias when completing staff evaluations. Which action is most appropriate? The answer options are A. Compare the performance of the nurse with another nurse, B. Focus on a positive experience and rate all areas based on that measure, C. Review the employee's previous evaluations before completing the new evaluation, and D. Gather feedback from peers regarding skills, performance, attitude, and competencies. The correct answer is option D. Gather feedback from peers regarding skills, performance, attitude, and competencies. A 360-degree evaluation method incorporates multiple perspectives and helps reduce personal bias, creating a more accurate and fair appraisal. Wait, before we move forward, here is your chance to level up your NCLEX prep for free. Yes, free. We are unlocking 5 full days of our NCLEX crash course with no strings attached. Join thousands of students who have already boosted their scores using our question banks, notes, and live classes. Tap the WhatsApp link below, type hi, and we will enroll you instantly. All right, next question. Turning to pediatric care, question 51 addresses how to support parents whose newborn has just been diagnosed with tetralogy of Fallot. The parents say, "We cannot believe our baby is going to die." Which nurse response is most appropriate? The options are A. Yes, that is so sad. What can I do to help you? B. Your baby will be fine. This is not so serious. C. Tetralogy of Fallot can be surgically repaired. Let's talk more about what you can expect. And D. Well, at least you get to spend time with your baby now. The correct answer is option C. Tetralogy of Fallot can be surgically repaired. Let's talk more about what you can expect. This response balances empathy with factual reassurance. It corrects the parent's misunderstanding while providing a hopeful yet realistic outlook. Now let us explore therapeutic boundaries in question 52, where a nurse feels angry after a client uses a condescending tone. What is the most therapeutic response? The answer options are A. That tone of voice makes me feel upset. B. You make me angry when you talk like that. C. Are you trying to upset me? And D. Why do you use that tone of voice with me? The correct answer is option A. That tone of voice makes me feel upset. This is an assertive I statement that acknowledges the nurse's feelings without blaming the client, preserving the therapeutic alliance and encouraging open dialogue. Finally, question 53 takes us into the practical realm of sterile suctioning technique. The nurse is preparing to suction a client's tracheostomy. Which order of steps is correct? The actions include identify the client, apply pulse oximeter, perform hand hygiene and PPE, prepare the kit aseptically, apply sterile gloves, suction saline to test catheter, and finally suction the client for a maximum of 15 seconds while withdrawing. The correct sequence is 1. Identify client and gather supplies. 2. Apply pulse oximeter. 3. Perform hand hygiene and PPE. 4. Prepare kit aseptically. 5. Apply sterile gloves. 6. Test catheter with saline. 7. Suction during catheter withdrawal. This order ensures both client safety and sterility. Continuous monitoring for oxygen saturation helps prevent hypoxia, and each step builds upon the previous to maintain a clean field and deliver effective airway management. Kicking things off with respiratory critical care, question 54 presents a client who has recently undergone tracheostomy after developing acute respiratory distress syndrome. Within the first 24 hours post-procedure, what is the nurse's best action to minimize bleeding around the tracheostomy insertion site? The answer choices are A. Deflate the cuff for 10 minutes every other hour. B. Avoid manipulating the tracheostomy and do not deflate the cuff. C. Monitor for signs of crepitus and report to the healthcare provider. And D. Change the tracheostomy dressing using 1/2 strength hydrogen peroxide. The correct answer is option B. Avoid manipulating the tracheostomy and do not deflate the cuff. During the first 24 hours, the tracheostomy site is fresh and vulnerable to bleeding, dislodgement, or accidental decannulation. Keeping the cuff inflated and avoiding unnecessary handling allows the site to stabilize. Shifting to abdominal assessment in question 55, the nurse hears a swooshing brute sound near the umbilicus while auscultating a client's abdomen. What should be the nurse's priority action? The options include A. Percus over the area to assess for dullness. B. Notify the healthcare provider. C. Gently palpate the abdomen. And D. Ask about recent bowel movements. The correct answer is option B. Notify the healthcare provider. A brute in this location raises concern for an abdominal aortic aneurysm, AAA, a life-threatening condition at risk of rupture. The nurse should not touch or further manipulate the area to avoid provoking a rupture. Next, question 56 focuses on safe and comfortable elimination for a client with limited mobility using a fracture bedpan. Which nursing action is correct? The answer options are A. Position the client prone. B. Raise the head of the bed to 30 degrees. C. Place the open rim of the bedpan toward the head. And D. Lower all side rails. The correct answer is option B. Raise the head of the bed to 30 degrees. This facilitates a more natural elimination posture, preserves dignity, and prevents aspiration. Finally, question 57 involves the administration of fresh frozen plasma, FFP. Before starting the transfusion, what is the nurse's most appropriate action? The options are A. Obtain baseline platelet count. B. Verify ABO compatibility. C. Infuse over 2 to 4 hours. And D. Obtain a 12-lead ECG. The correct answer is option B. Verify ABO compatibility. Even though FFP does not contain red blood cells, it does contain antibodies that can cause severe hemolytic reactions if incompatible with the recipient's blood type. Starting with question 58, the nurse is assessing a client with Raynaud's phenomenon. What should the nurse expect to observe during an episode? The options are A. Digit color changes. B. Flapping hand tremor. C. Painless skin ulcers. And D. Janeway lesions. The correct answer is option A. Digit color changes. Raynaud's phenomenon is a vascular disorder that causes classic triphasic color changes in the fingers or toes when exposed to cold or stress. First white, pallor, then blue, cyanosis, and finally red, reperfusion. Clients may also report numbness or burning. In question 59, the nurse percusses the thorax during assessment. Which finding requires further evaluation? The choices are A. Dull tone over the spleen. B. Hyperresonance over an adult's lung tissue. C. Flat tone over bone. And D. Hyperresonance over a child's lung tissue. The correct response is option B. Hyperresonance over an adult's lung tissue. This sound suggests abnormal air trapping, as seen in conditions like chronic obstructive pulmonary disease or pneumothorax. Moving to congenital conditions in question 60, a newborn presents with abdominal contents protruding through the umbilical area, but enclosed within a peritoneal sac. What should the nurse suspect? The answer choices include A. Intussusception, B. Gastroschisis, C. Omphalocoele, and D. Hirschsprung's disease. The correct choice is option C. Omphalocoele. In omphalocoele, the herniated organs protrude through the umbilical ring but remain enclosed in a sac, and this is often linked to genetic anomalies. Quick heads up! If you are feeling stuck or want a more structured approach to studying, we are offering free 5-day access to our full NCLEX crash course. You will get everything: video walkthroughs, priority questions, rationales, and expert guidance. It is like having a personal NCLEX coach. Just hit the WhatsApp link, message "Hi," and we will unlock it for you right now. Now, let us get back to the test. Now to a rapid response priority scenario in question 61. The client in labor has a prolapsed umbilical cord. The correct sequence of nursing actions is 1. Apply pressure to lift the presenting part. 2. Stay with the client and call for help. 3. Place client in Trendelenburg position. 4. Administer oxygen. 5. Prepare for cesarean delivery. This sequence reflects immediate life-saving priorities. Relieve cord pressure to restore blood flow, activate HELP, reposition for gravity relief, optimize oxygenation, and expedite delivery. Never try to reinsert the cord. The nurse's gloved hand maintaining pressure is the bridge between fetal distress and safe birth. Finally, question 62 asks about minimizing discomfort during a newborn's heel stick. The options are A. Cold compress, B. Turn off lights, C. Squeeze the heel, and D. Swaddle the infant. The correct answer is option D. Swaddle the infant. Swaddling helps calm the baby and provides comfort. When paired with sucrose or breastfeeding, it greatly reduces pain. Let us now move into a topic that is both clinically essential and frequently tested: nasogastric tube placement. For question 63, a 26-year-old client requires nutritional support through a nasogastric tube. After the nurse inserts the tube, which method provides the most definitive confirmation that the tip of the tube is positioned correctly in the stomach? The options include option A, withdraw gastric fluid to check for stomach contents. Option B, test the aspirated contents for acidic pH. Option C, listen over the abdomen while injecting air into the tube. Or option D, request an abdominal X-ray to confirm tube location. The correct answer is option D, request an abdominal X-ray to confirm tube location. Radiographic imaging is considered the gold standard for verifying tube placement because it provides visual confirmation of the tube's exact position, ensuring that it is in the stomach and not the lungs. While aspirating stomach contents or testing pH can be helpful, these methods are not fully reliable due to variables like feedings or medications. Likewise, auscultation with air insufflation is no longer recommended as a standalone method due to its poor accuracy. In short, do not initiate feeding until placement is confirmed by X-ray. This practice prevents life-threatening aspiration and guarantees safe nutritional support. Shifting focus to safety in the home environment, question 64 evaluates your understanding of fall risk assessment. During a home visit, the nurse is assessing the living environment of an elderly client. Which of the following would be classified as an environmental risk factor for falls? The options include option A, mild confusion and forgetfulness, option B, reduced visual acuity, option C, diminished hearing sensitivity, or option D, inadequate lighting in hallways and rooms. The correct answer is option D, inadequate lighting in hallways and rooms. Environmental factors like poor lighting significantly increase the risk of falls, particularly for older adults who may already have mobility or sensory limitations. While the other choices such as cognitive decline or vision loss are personal health-related risks, they are not considered environmental hazards. The key takeaway here is that optimizing the physical home setting, especially lighting, flooring, and furniture layout, is crucial in fall prevention. Simple changes like motion sensor lights and removing clutter can drastically reduce injuries in older adults. Now, let us transition into prenatal care with question 65, which asks about risk factors for preeclampsia. The nurse is reviewing prenatal risk factors with a pregnant client. Which of the following would not be considered a risk factor for the development of preeclampsia? The options are option A, chronic low blood pressure, option B, maternal age of 36 years, option C, African American ethnicity, or option D, positive maternal family history of preeclampsia. The correct answer is option A, chronic low blood pressure. Preeclampsia is a condition characterized by high blood pressure and organ dysfunction after 20 weeks of gestation. Chronic hypotension is not a risk factor and may even offer some protective effect against the hypertensive features of the disorder. On the other hand, older maternal age, certain racial backgrounds, and family history are all recognized contributors. Understanding these distinctions helps prioritize care and screen high-risk populations more effectively during pregnancy. As we continue, let us practice a dosage calculation with question 66 involving insulin administration. Now, let us work through a dosage calculation for a client in a hyperglycemic hyperosmolar state. The nurse is preparing to administer an intravenous bolus dose of regular insulin, prescribed at 0.1 unit per kilogram. The client's weight is 125.90 kilograms. To calculate the dose, we multiply 0.1 by 125.90, which gives us 12.59 units. Since we always round to the nearest whole number when administering insulin, the correct dose is 13 units. This scenario reinforces the critical importance of accurate insulin administration, especially in acute settings like hyperglycemic crises. In critical care, regular insulin is delivered intravenously for rapid effect, and precise dosing is essential to prevent serious complications such as hypoglycemia or cerebral edema. Additionally, nurses must always double-check insulin calculations, follow protocol closely, and monitor electrolytes, particularly potassium, as insulin shifts potassium into cells and can cause dangerous hypokalemia if not managed correctly. Let us now explore a lab interpretation question linked to respiratory conditions in question 67. A client with chronic obstructive pulmonary disease has a persistently elevated red blood cell count. The nurse understands that this laboratory finding is most likely due to which factor? The options are: Option A, increased carbon dioxide levels; Option B, decreased oxygen levels in the blood; Option C, fluid loss through skin and lungs; or Option D, inadequate daily fluid consumption. The correct answer is Option B, decreased oxygen levels in the blood. In COPD, chronic hypoxia triggers the kidneys to release erythropoietin, which stimulates red blood cell production, a condition called secondary polycythemia. This adaptation helps improve oxygen delivery, but it also increases the risk of blood viscosity and clot formation. The other options may contribute to temporary changes in lab values, but do not cause true polycythemia. Therefore, elevated RBCs in a COPD client point to prolonged hypoxemia and should prompt the nurse to assess oxygen saturation, symptoms of clotting, and the appropriateness of home oxygen therapy. Now moving into a therapeutic communication scenario in question 68. A client scheduled for total hip replacement expresses anxiety. Which response by the nurse is most therapeutic? The options are: Option A, feeling anxious before surgery is something everyone goes through. Option B, let me walk you through every step of the surgery. Option C, can you share what you have already been told about your surgery so far? Or Option D, we can talk about the pain and the recovery process. The correct answer is Option C. Can you share what you have already been told about your surgery so far? This open-ended question invites dialogue, allowing the nurse to assess the client's understanding, fears, and expectations. Therapeutic communication is not about giving immediate advice, but about active listening and validating the client's feelings. The other choices either minimize the emotion or redirect the focus too soon without exploring what the client actually needs. Finally, with a medication teaching question in question 69, the nurse is discharging a client-prescribed apixaban, an oral anticoagulant. Which client statement indicates a need for further teaching? The options include Option A, I will take apixaban at the same time every day. Option B, if I notice any bleeding, I will call my healthcare provider. Option C, if I miss a dose, I will take it as soon as I remember, but not double up. Or Option D, I should avoid eating too many leafy greens while on this medication. The correct answer is Option D. I should avoid eating too many leafy greens while on this medication. This statement reflects a misunderstanding. While vitamin K intake must be consistent in clients on warfarin, it has no bearing on apixaban, which is not vitamin K dependent. This confusion is common and highlights the need for clear patient education when transitioning from warfarin to newer anticoagulants like apixaban or rivaroxaban. The correct teaching point is that apixaban, hang tight, because I want to make sure you do not miss this. Our full NCLEX crash course is now available to you 100% free for 5 days. You will get video lessons, strategy guides, study plans, and a question bank that mirrors the real exam. It is all yours. Just click the WhatsApp link, type "Hi," and you are in. All right, let us keep pushing forward. You have got this. As we begin, Question 70, let us focus on a critical nursing priority. Infection prevention during central line care for clients receiving total parenteral nutrition. The nurse is caring for a client who is receiving total parenteral nutrition via a central venous catheter. Which of the following nursing actions is most appropriate to help prevent complications during central line care? The answer choices include A. Insert an indwelling urinary catheter to monitor fluid status. B. Weigh the client in the morning before the first void. C. Have the client wear a mask during the central line dressing change. And D. Initiate continuous cardiac monitoring during TPN infusion. The correct answer is option C. Have the client wear a mask during the central line dressing change. This intervention reflects the priority of preventing infection, especially central line-associated bloodstream infections, or CLABSIS. TPN solutions are rich in glucose, creating an ideal environment for microbial growth. Therefore, both the nurse and the client must wear surgical masks during dressing changes to prevent microorganism transmission. Moving forward to question 71, let us examine the safe use of anticoagulants in clients receiving intravenous heparin therapy. A client is receiving a continuous intravenous infusion of heparin for treatment of multiple venous thromboembolisms. What is the nurse's primary laboratory goal during this therapy? The options include A. To maintain the partial thromboplastin time, APTT, at 1.5 to 2.5 times the normal control. B. To maintain the international normalized ratio, INR, at 1.5 to 2.5 times the normal control normalized ratio, INR, between 2 and 3. C. To increase the prothrombin time, PT, to 1.5 to 2.5 times normal. And D. To maintain the INR between 3 and 4. The correct answer is option A, to maintain the APTT at 1.5 to 2.5 times the normal control. Heparin acts on the intrinsic pathway of the clotting cascade and is monitored using the APTT to ensure it remains in a safe therapeutic range, typically around 60 to 80 seconds depending on the lab. Transitioning into gastrointestinal pharmacology with question 72, we focus on symptom relief for clients with irritable bowel syndrome. A client with a history of IBS has been prescribed dicyclomine hydrochloride to manage their symptoms. Which client response would indicate that the medication is working as intended? The answer options include A. Reduction in abdominal cramping. B. No episodes of nausea or vomiting. C. Improvement in urinary flow. And D. Relief from burning sensation during urination. The correct response is option A. Reduction in abdominal cramping. Dicyclomine is an anticholinergic agent used to relieve intestinal smooth muscle spasms and reduce cramping in IBS. Its primary therapeutic effect is alleviation of abdominal discomfort, bloating, and spasm-related pain. Next up, in question 73, we turn to injury prevention and proper body mechanics. During a staff training session, the occupational health nurse asked how to reduce the risk of back injuries when lifting patients or heavy equipment. Which of the following statements reflects correct lifting technique? The options are A. I should keep my legs straight while lifting to avoid strain. B. It is safer to carry heavy objects away from my torso. C. I will avoid twisting my body while lifting and turn with my feet instead. And D. Maintaining a narrow stance will help me stay balanced. The correct response is option C. I will avoid twisting my body while lifting and turn with my feet instead. Twisting during lifting increases torque on the lumbar spine and leads to back injuries. Proper body mechanics include keeping the spine neutral, pivoting with the feet, and using the legs, not the back, for lifting. Finally, wrap up with last. Question 74 brings us to emergency care involving a chest tube dislodgement. A hospitalized client with a chest tube for pneumothorax gets up to use the bathroom. During ambulation, the chest tube accidentally becomes dislodged from the insertion site. What is the nurse's priority action? The choices include A. Reinsert the tube after asking the client to perform the Valsalva maneuver. B. Apply direct pressure with a transparent dressing to the site. C. Cover the insertion site with a sterile dressing taped on 3 sides. And D. Assist the client to bed and place them in low Fowler's position with knees bent. The correct answer is option C. Cover the insertion site with a sterile dressing taped on 3 sides. This technique allows air to escape on exhalation, while preventing further air entry on inhalation, reducing the risk of developing a life-threatening tension pneumothorax.